Hello, I would like to introduce Dr. Gleb Sapersky. Dr. Gleb is a thought leader, and he's been featured in more than 550 articles and had more than 450 interviews, including Times, Inc., CBS, Business Insider, CNBC, and Fast Company. He's a cognitive neuroscientist and behavioral economist. So he has had over 15 years in higher education, 7 as a professor at Ohio State. So I want everyone to give him a warm welcome, and we're very, very lucky to have him here today. So thank you, and take it away, Dr. Gleb.
Thank you, Janice. I really appreciate that warm and kind introduction. And I'm glad to have the chance to share with you about how to adapt and plan for the COVID-19 coronavirus pandemic using neuroscience, specifically for internal auditors in this month of internal audit awareness. So let's talk about how to do that. The presentation will have 2 parts. The part before the break will talk about the context and the judgment errors we tend to make because of how our brains are wired around COVID-19 and similar disasters. The second part of the presentation after the break will deal with how do you adapt to it as internal auditors in particular, and more broadly, how do you as trusted advisors help your organizations adapt to the situation. So the first part will be problems, issues, then we'll have a Q&A on problems, issues, challenges, and then the second part will be solutions, and then Q&A on the solutions, just so you know how we'll go. All right, now that you know, let's take it away. The first part, we want to think about how people are so underprepared, made very bad estimates of COVID-19. I mean, Elon Musk is in the headlines right now for trying to open up his factory a little bit sooner than would be ideal for many perspectives, but he's not only in the news for opening up the factory much sooner than ideally would be the case, he also made bad estimates about COVID-19 early onward. So for example, already on March 6, 2020 of this year, he tweeted, "The coronavirus pandemic is done." And he has a lot of followers. So he's probably the most prominent entrepreneur, or at least the loudest, of this kind of new money, new entrepreneur, startup technology. And so as you see, it had 1.7 million likes. Huge impact, giving the idea that coronavirus is nothing to worry about. And then already after the national declaration of emergency in the US by the White House, he tweeted on March 20th that based on current trends, probably close to 0 new cases in the US by the end of April. Well, as you can tell, it's mid-May and the cases just keep growing. So he's definitely wrong on that. So that's kind of all new money. You know, we can think maybe new money, maybe entrepreneurs are a little bit brash, maybe they're underestimate threats. So what did people who are more old money, financial analysts, very respected folks were saying? People like Goldman Sachs. Let's turn to Goldman Sachs. What did they say? Well, they, of course, one of their jobs, they serve their clients in order to help their clients make good estimates about the future, about what's going on, about the reality of the situation. So they estimated US GDP growth for the second quarter, and they made an estimate on February 24th. They estimated that it would grow at 2.7%, which is a little bit lower than they were estimating before, because of COVID-19. They said, well, because of COVID-19, it'll have a growth of only 2.7%. Then what happened 3 weeks later on March 15th? They made another estimate. They revised their previous estimate of 2.7% growth to 5% decline. That's a 7.7% decrease in their estimates. That's a huge decrease. Huge. And of course, it's very painful for their clients for whom they gave bad advice on February 24th because their clients invested their money on the estimate that it's going to be 2.7% growth as opposed to a decline. But what happened 5 days later on March 20th? March 20th, they revised their estimate yet again and said it's going to be a 24% decline. 24% decline. So in 5 days, it went from 5% decline to 24% decline. Clearly, old money also got their numbers wrong, their estimates wrong of what's going on with the pandemic. That is why so many people, so many leaders were underprepared, really unprepared, completely unprepared in many ways for COVID-19, for the pandemic. And this is what's happening right now what happened earlier and still is to some extent what's happening. People aren't really prepared for the impact and the long-term duration of COVID-19. We'll talk about that. So because they listen to people like Elon Musk, and so many people are right now listening to him saying, yes, let's reopen, let's do that, and listening to Goldman Sachs and so on, who are way too optimistic about what's going on. So the leaders who were caught unprepared because they were listening to old money or new money analysts, they turned to their business continuity plans, their emergency plans, their disaster preparedness plans. And this is something that I'm quite familiar with because as a disaster avoidance expert, so I run a company that works on these plans. It's one of our areas of expertise. Unfortunately, as someone who works on these and helps create these, I can tell you that business continuity plans are not a good fit for the situation. They're not a good fit for what's needed. Well, why not? Because they're great for emergencies. Imagine Houston being flooded. That's a great fit for a business continuity plan. That's a break in your business for maybe a week, maybe 2 weeks, or imagine an earthquake. And again, maybe a week at most, 2 weeks if it's not catastrophic earthquake, but most regular earthquakes. That's kind of the kind of break that you're expecting. But COVID-19 is not an emergency. That's not what it's about. That's not an emergency. It's like Houston is flooded and then stayed flooded. And people are still acting like Houston was flooded and then the flood will go away pretty quickly. COVID-19, it's a major disruptor. It's slow moving, high impact, and long term. And we make bad decisions about such things. Unfortunately, relying on business continuity plans leads to a lot of problems. Whereas you need to realize that this is going to be a marathon, not a sprint, and you need to plan for the long term. So let's talk about facts about COVID-19 just to get on the same page, have the same context. It's highly contagious. Without interventions, every infected person infects 2 or 3 other people. And as a result, the number of cases doubles every 3 to 6 days. Most people have a real difficult time of envisioning cases doubling every 3 to 6 days. Of course, you're internal auditors, so you have much better awareness of the math. What happens if you double things every 3 to 6 days? This is bad. There's a serious risk of illness, risk of serious illness. So of those who get sick, 10 to 20% get seriously ill. That includes people who are asymptomatic. So we know that about 50% of people at any given time are not showing symptoms, people who have COVID-19 and they aren't showing symptoms. So of all of those people, both people who show symptoms and people who don't, 10 to 20% get seriously ill. So that means that of all people who show symptoms, about 20 to 40% get seriously ill, just so you understand the math. The half of the seriously ill need hospitalization. So that's 5 to 10% need hospitalization. That's kind of the math of the thing. It's much more deadly than the flu. So the flu kills about 0.1% of the people it infects, whereas with COVID-19 at the lower bound of estimates, and that includes people who are asymptomatic, to a lower bound of 0.5%, higher bound of 1% with excellent, great hospital treatment at our best. But we need to understand that there are some dynamics going on here. It's much more risky for people who are over 60 and people with underlying health conditions who are younger than 60. And we don't have any effective treatments yet. You might have heard of drugs like remdesivir. It's great for reducing length of hospital stays. That's what we know. It's effective for that. So it reduces hospital stays from 15 days on average to 11 days on average from the latest study of it. We don't really know yet whether it decreases mortality, but it decreases morbidity. It decreases people's time being sick. So that's great, but it's not really an effective treatment in the sense of seriously decreasing mortality. So that's what you need to understand. Now, vaccine is going to be the only effective solution to COVID-19. That's the only way we'll actually fix the situation. And human trials for a vaccine, we need them to test the safety of the vaccine and to test the effectiveness of the vaccine. Now, throwing all the money at it that we can, throwing all the research at it that we can, cutting all the red tape, whatever regulations, bureaucracy, they're estimated to take at least a year, these human trials. So first, the safety trials, which take about 4 months or so, and then the effectiveness trials, which take about 8 months or so. And that's a super limited compressed timeline. Regularly, this takes about 4 to 5 years. So that's vaccine part 1. You have to understand that most vaccines don't make it through human trials, and that's a big problem. Most of them don't make it through human trials, and the kind of vaccines that are right now in human trials. So we already had a vaccine, and the Moderna vaccine, you might have heard about it, was in human trials from mid-March or so. But most vaccines don't make it through human trials, especially vaccines that are rushed into production, like the Moderna one and a number of others that are currently being rushed into production. Just saw a study that came out about maybe 10 days ago, around that time, that showed that there's more strains of COVID-19 than we anticipated. And one of the strains that was found that developed later, mutated later, seems quite a bit more lethal than the original strain. And the vaccines that are currently out there were based on the original strain of COVID-19. We're not yet sure whether it would also be effective against this new, what seems like a more lethal strain of COVID-19. So that's an example of the kind of problems you have when you rush vaccines into trials. This is something that would have been better in a way if people waited a little bit before rushing them to trials. But we'll see what happens. Maybe it is going to be effective against all variations of COVID-19, but really don't bet on it. So it's likely that the first trials will be unsuccessful, just being realistic. Now, what happens after the vaccine is ready? Well, the government would need to coordinate the process of producing the vaccine, the process of distributing it, and the process of vaccinating it. The government in the US, at least, has not proven to be very competent at what was needed to address COVID-19. For example, we still don't have nearly enough testing going on for the actual opening of the economy that would be needed in order to open the economy safely. And we'll talk about what happens as a result, but that's an example of where the government has not shown very high competence in coordinating the testing, in coordinating distribution of ventilators, various other equipment. So this is a big problem. So this is something that needs to happen. Of course, the government needs to coordinate the production, distribution, and vaccination of people. So let's talk about possible timelines so we understand where we're standing. There's an optimistic timeline, there's a moderate timeline, and there's a pessimistic timeline. The optimistic timeline, that would be great. This would be vaccine approved for mass production by summer 2021. So we're assuming that the Moderna vaccine or one of the other several vaccines, there's I think about 8 that are in trials right now, is going to be effective. It's going to be effective, it's going to be great, it's going to really be highly effective in addressing COVID-19. That's the assumption. That's the optimistic assumption, very optimistic. Then the production, distribution, vaccination. So the government gets its act together, the central government, federal government gets its act together and really helps companies that create the vaccine coordinate the production, distribution, and vaccination of people. And we assume that, anti-vaxxers don't try to fight vaccination too hard. It will take 6 months. So that's the minimum time period. So we'll have most people vaccinated, at least those who would in vulnerable categories, so people over 60 and people who are immunodeficient and have other vulnerable categories by early 2022. This is a very optimistic scenario. So you have to realize, and it's hard to realize, it's hard for me to say this, that the optimistic scenario is that we'll deal with COVID-19 by early 2022. This is very unlikely. This is way too optimistic for you to make a good bet on this. I'd say this is less than 5% chance. Sorry. The moderate scenario. This is what's more likely to happen. It's going to be approved for mass production sometime between the end of late 2022 to something like late 2026. So with a midpoint of 2023. That's something like that. And that depends. There's a wide variance there. So I'm just giving that wide variance. At the midpoint of it, that is 2023. Then production, distribution, vaccination, we're not assuming a high competence. We're assuming a moderate level of competence here by the government. It will take a year instead of 6 months. And then most people will be vaccinated, in this case, by 2024. So again, vulnerable, that's what I mean by most people. And then, of course, more people later. So we'll realistically deal with COVID-19 by that time. This is the most likely scenario. I'd say that's 70% chance of we'll deal with COVID-19 by the end of sometime by late 2022 to late 2026. That's kind of the midpoint moderate scenario. But there's unfortunately a pessimistic scenario. it's quite possible that COVID-19 proves more difficult to provide a vaccine for than we hope. There's definitely many illnesses that are like that. So it's going to be approved for mass production by 2026. So that's the vaccine is approved for mass production, then production, distribution, vaccination, again, not assuming a high level of government competence, just a moderate one, it'll take a year. And so then we'll have most people vaccinated by 2027. Now, this I estimate is 25% chance, right? 5%, 70, 25. I mean, you might think this is too cynical. You might think that, hey, this seems unreal by 2027. But if you know what we're dealing with in terms of the flu, we still don't have an effective vaccine for the flu. We've been battling the flu for over a century. The vaccine we have for the flu is only 50% effective. Unfortunate, but true. So this is what we're dealing with. And this is not easy to hear. When I was realizing this myself, I mean, this is really painful information when I was researching this and looking at the situation. My expertise is in risk management, disaster avoidance, decision making, and looking at the kind of situations that were happening both in the research on the epidemiology and the impact for businesses, for nonprofits, for all sorts of organizations, municipalities, was really painful for me to hear. And especially it got really painful. So my dad, he's 79. He lives in New York City with my mom, who's 70. And he, about 5 weeks ago, started coughing really badly, obviously New York is the epicenter of COVID-19 in the US still. So he started coughing really badly, having really difficulty breathing, loss of appetite. So all the things associated with COVID-19 that are less associated with things like the flu. And so he was really having a lot of trouble. And I'm based in Columbus, Ohio, so I couldn't go to New York City to see him, to support him. And he was having a lot of trouble, and he was getting worse and worse. My mom, fortunately, she had medical training. She's a psychiatrist, so she has some medical training, and she was taking care of him. She was giving him whatever you need to do from a physical perspective to minimize the development of pneumonia. He was kind of very much on the edge of going to the hospital. My mom was thinking, should I take him to the hospital or should I not? But the hospitals in New York City were so overcrowded and it was so bad there that she just decided that, okay, she'll try to treat him on home. Eventually, he started getting better, so he didn't have to go to the hospital yet. I hope he won't, but he's still on the mend and he's recovering, fortunately. But that's something that hit me pretty hard as well. Anyway, so when I talk about this to my clients, the information about the reality of COVID-19, its impact, its long-term impact, and these estimates, they find it really hard to hear as well. But what I tell them and what I tell myself that makes it easier is that the earlier we accept the painful but accurate information, the more quickly and effectively we can adapt to this major disruption, because it'll be much more painful for us if we don't. So that's what we have to deal with. And we have to understand that in the meantime, because of the kind of situation that we have, the kind of government system that we have, suppression is our only option. It's at least for non-authoritarian societies. Societies that don't, unlike China, aren't able to put chains and locks on people's doors like they did in Wuhan, and aren't able to mandate that everyone gets an app, mobile phone app that does contact tracing automatically. For example, in Beijing, everyone has to have an app on their mobile phone, which prevents them or which notifies the central authorities if they leave Beijing. So that's an example of a thing that is not going to happen in the US. So it's going to be very hard to actually do effective contact tracing in the US. Now, some countries have been able to do that. So, for example, Germany is very similar to the US in terms of large size, very well developed, very diverse, very complex, lots of polarization, lots of conflicts and tensions, but it has had a wonderful response to COVID-19 by comparison. So the cases there were pretty extensive, but it had only 7,000 deaths or so by today, compared to, of course, over 80,000 in the US. So Germany, comparable country, did a much better job because it did a lot of contact tracing early onward. And so it was able to keep the pandemic infections down compared to the US. In the US, the only tools we have are shutdowns and social distancing. That's the only tools that we have. Because otherwise, hospitals will get overwhelmed. And that's what happened in northern Italy, and that's what happened in New York City. And we know that when hospitals get overwhelmed, the people who would go to hospitals and get treatment will die. And that's 5 to 10% of the population. The death rate goes up from 0.5 to 1% to 5 to 10%. That's the reality of the situation. And this is not going to be tolerable for any politicians. We're not even talking about the ethics and morals of it. The overcrowding of hospitals is not something that politicians can realistically tolerate. So while suppression is very costly, it is effective. We know that areas that had really serious good lockdowns have been able to flatten the curve and have been able to bring down the infection rate. Now, you want to understand that there's a specific dynamic that has to do with suppression. Once you institute hard suppression, so as a number of countries have successfully done, like South Korea, and Taiwan and so on, when they started to open up their countries, their regions, then there was more COVID-19 happened. This is because COVID-19 is just as infectious. It's simply you reduce the infection rate. So when they started to open up, you had more infections. So for example, South Korea started to open up, and then there was, especially their bars and their nightclubs, there was a nightclub super spreader event where a number of people in a nightclub got sick just because of one person who went there, partied in a number of nightclubs. And after that, they had to close their nightclubs and restaurants. So they were forced to bring back restrictions. This is what will happen in the US. I can guarantee it. I'll be happy to bet 1 to 10 that that's what's going to happen in the US. So $10 to $1,000. You'll have looser restrictions, which are happening in a number of states right now. And then it will be an increase in cases. As the cases increase, the medical system will come closer and closer to being overwhelmed. And no politician can realistically afford to have their state, their region be such that hospitals are stuffed full of body bags, like happened in New York City. You have to bring refrigerated trucks there in order to hold all the bodies. So there will be tighter restrictions after that. And then a decrease in cases, as happened in New York City and elsewhere. And this will be a pattern of repeating waves. That's what we're dealing with until we get to vaccination. That's what will happen. That's what our future holds. That's what you have to prepare for. You have to prepare yourself, your families, your organizations, your everything that you're doing, your careers for the situation. This is not a short-term emergency. It's a major disruption. And even the most optimistic scenario, as I said, we can only hope for vaccine, but by early 2022, by the start of 2022. Regardless of what happens, even if we're in that very optimistic, very lucky world, the 5% world, the world will change forever. We're never going back to January 2020, ever, ever, ever. Think about this. Waves of restrictions, lockdowns, and so on, they'll change people's habits, norms, values, desires, expectations. That's all. That's what you have to realize. That's what we're dealing with. And this will be hard and this will be challenging. It's hard for me to say, and it's going to be hard for people to accept every time I say it, but it's true. And your role as a trusted advisor, so you as an internal auditor are a trusted advisor to your organization's leadership. That's your role. You want to empower your leaders to realize the extent of the major disruptions. Leaders tend to be overwhelmingly too optimistic. This is just what the research on this topic shows. So evaluating optimism, pessimism, leaders, people at the top levels of the organization, especially CEOs, tend to be very, very optimistic. And you have to help them realize the extent of this disruption. You need to help them prepare for this really uncomfortable and challenging and painful reality. And you'll help them by doing so, you'll help them achieve their leadership goals. I mean, they want to have the right preparation for the situation. They're just intuitively too optimistic. And you will build up your profile as a trusted advisor. You'll build their trust in you if you can really help them prepare for the reality of the long term. So overcoming the short-term discomfort of facing the truth of reality for the sake of the long term. And that's your role as a trusted advisor, especially from the perspective of being an internal auditor and helping the organization prepare for that long term. So I want you to remember to not plan for the optimistic scenario. Too many companies, too many organizations, they act as though problems will blow over soon. But there's a good phrase that I recommend that you share with your leaders, attributed to Vince Lombardi, famous football coach, that hope is not a strategy. It's a really bad perspective to have hope as a strategy. So you want to prepare for this scenario, at least ideally the pessimistic one. That's what I strongly encourage my clients to do. So prepare for the more pessimistic scenario. The pandemic is a slow-moving threat, and we are very bad at making such decisions. That's my area of expertise: decision-making, risk management, and how our brains cause us to misdecide on making good decisions. We are very bad at dealing with slow-moving, unusual threats. Because of the structure of our brain, because of our evolutionary psychology, we tend to greatly underestimate the impact and the probability of threats, leading to decisions that harm our businesses a lot. A little bit about me, so you know who I am and that I know what I'm talking about: my experience, clients, media, and books. So I'm the CEO of Disaster Avoidance Experts. It's a boutique consulting, coaching, and training company. We have 20 years of helping clients in disaster avoidance, risk management, decision-making, and strategic planning around these issues. I also spent 15 years in academia in cognitive neuroscience and behavioral economics. I published in venues like Behavior and Social Issues, Journal of Social and Political Psychology, and other high-profile peer-reviewed venues. So that's part of my background experience. I work with a whole bunch of clients. Our company works with them. I work with them from innovative startups to Fortune 500 companies, ranging from Aflac to Xerox. So if you know Zappos, give me a call. Media. I've been featured, as Jenny's kind of described, in literally hundreds of media venues. I think I published over 550 articles by now. Venues like Time, Inc. Magazine, Fast Company, CNBC, and interviews on NPR, CBS News, publications, Scientific American, Newsweek, and so on. And finally, I published 4 best-selling books. One, I'm best known for Never Go With Your Gut, How Pioneering Leaders Make the Best Decisions and Avoid Business Disasters with Career Press, great publisher. The Blind Spots Between Us, How to Overcome Unconscious Cognitive Bias and Build Better Relationships. That's focused on relationships, of course. Never Go With Your Gut focuses on decision-making. The Truth Seeker's Handbook, a science-based guide, focuses on how do you realize and deal with the truth of reality, which is often very painful. And finally, my just published book, which fortunately bestseller list, is Resilience, Adapt and Plan for the New Abnormal of the COVID-19 Coronavirus Pandemic. So that's kind of my background, just so you know where I'm coming from. So let's talk a little bit about decision-making and why such bad decision-making is common. We are dealing always with dangerous judgment errors called cognitive biases. And these cognitive biases stem from our evolutionary background, our psychology, and just the structure of our brain, just the way that our brain is wired, the way that information flows from one part of the brain to another, make many mistakes because of that. One of the biggest problems that we face because of our evolutionary background is the fight or flight response to threats. It was great for our ancestors. It's our gut reactions, our threat response, gut reactions is great for the savanna environment in which our ancestors lived. That's what our intuitions are wonderful for. So it was life-saving for those hunters-gatherers who had to face immediate, intense, in-the-moment threats. You might have heard of the saber-toothed tiger response, where you had to jump at 100 shadows in order to get away from that saber-toothed tiger. That's a great flight response. Or where you have to defend yourself from an attacking tribal member. That's a great fight response. But that's a bad fit for today's world, the fight or flight response, because the risks are not saber-toothed tigers. We have many less saber-toothed tigers in the modern world. The risks are long-term. They're uncertain. They might come from your email, from your news source, from your phone, notifications on your phone. That's where threats come from, and we are not wired to deal with them well at all. There are specifically 3 dangerous judgment errors, cognitive biases, that are most relevant for COVID-19 bad decision-making: normalcy bias, planning fallacy, and hyperbolic discounting. Let's go through them one by one. Normalcy bias. Now, in the savanna environment, in the savanna context, our environment wasn't changing. So it would always be the same, pretty much, a little bit of changes. So right now, we tend to assume that the future will be like the past, just our gut intuitions, our reactions, that the future will be normal, it will be like the past, the next couple of years will be like the last couple of years, maybe more people will be using their smartphones. And this leads us to really make bad decisions around major disruptors, around major changes. We underestimate both their likelihood, the probability that they'll happen. We dismiss them. We say, oh, they won't happen, no problem. And the impact if they do. So that is a huge problem for us when we're dealing with things like pandemics. That's obviously a big one. when we're dealing with things like the fiscal crisis of 2008, 2009, that's a huge one, and many other issues that people tend to dismiss. That's a normalcy bias. So that's a big one that really harms us and makes it very hard for us to viscerally appreciate that we're never going back to January 2020 and all the consequences of this. So first one. Next one, the planning fallacy. We assume that the future will go according to plan. We feel confident about ourselves, about our plans, and we envision the future as being aligned with us because we're confident. So this is especially the case for the top leaders of organizations. And this leads us to not prepare for a lot of problems and risks that we should. You might have heard that failing to plan is planning to fail. That phrase, failing to plan is planning to fail. This is a very misleading phrase because it causes people to assume that once they make a plan, everything will be good, things will go according to plan. Not the case. A much more effective phrase that I tell my clients to use is failing to plan for problems is planning to fail. Again, failing to plan for problems is planning to fail. It's much more effective because the reality is things will come up that we don't expect and they will cause us a lot of problems. And so as a result, we underestimate the needed resources of time, money, information, social capital, strategic planning resources, education resources to address the problems that will actually happen. Finally, hyperbolic discounting. This is another important one. In the savanna environment, it was very valuable for us to be short-term oriented because, if you kill the mammoth, you expended a lot of resources on killing a mammoth, but you can't freeze the meat, and so the meat will go to waste. In the current environment, that's not the reality that we're facing. You can always put your money in a bank, a company can save for the future, make an effective long-term plan. You can invest in your professional career. I mean, what are you going to do with your professional career in the savanna environment? Become a better ex-chipper? That will not help. So that is what we're dealing with. We tend to be short-term oriented, too short-term oriented in our intuitions. And we underestimate the importance of the long term. This is what's happening in a number of companies that are rushing to open up right now, number of organizations that are rushing to get back to the office, and that are underestimating the long-term impact of the pandemic and what they will face in terms of waves and patterns of restrictions and loosenings. They're not realizing the kind of disruptions that they will face and the consequences for themselves and their employees of the bad decisions they're making. So that's a big problem. So these are 3 dangerous judgment errors. In order to overcome these dangerous judgment errors, what you need to do is realize that you need to go against your intuitions. And as internal auditors, you know that, right? If people just followed, if it was great for our organizations for people to just follow their intuitions, then you wouldn't need internal auditors who would be evaluating things, checking things out, making sure that our intuitive behaviors don't lead organizations in the wrong direction. Well, this happens to be the case that you need to do the sort of the same thing in decision-making and strategic planning and assessments around COVID-19 and other major decisions. You need to go against your intuitions because our intuitions evolved to help early humans survive, and they were not wired for making good decisions in the modern world. I mean, you kind of know this already. For one of our biggest, strongest intuitions is to be triggered by sugar. So when we see sugar, it was very tempting for us to eat it because in the savanna environment, if you came across a source of sugar, honey, bananas, apples, it was very important for you to eat as much of it as possible. That's how you survived and thrived. We're the descendants of those who had a very strong fight or flight reflex and those who ate a lot of sugar when they came across it. Of course, in the modern environment, if you come across a source of sugar, it's not a good idea to eat as much of it as possible. Donuts are served in a box of dozen donuts. So if there's a box of dozen donuts in the break room, that doesn't mean you should eat the dozen donuts, not, regardless of whoever else might want them. It's going to be bad for you. It's going to be unhealthy. Or, if there's a gallon of ice cream in the fridge, take it out, and you should not eat more than a cup or 2 of ice cream. That's a serving of ice cream, right? But how hard is it to prevent yourself from eating more donuts than you should? Maybe 1's okay, 2, but you got to stop at that 3rd donut. You can't eat more than 2 donuts. You know that. But it's very tempting once you start eating to eat more, or once you have a cup, serving of ice cream, it's very tempting to eat half the jar. That's very intuitive because of how we're triggered. And you had to develop healthy patterns to address this yourself There's a reason there's an obesity epidemic here in the US, but I'm sure you've worked on having a healthy diet, so maybe eating fruit instead of donuts. That's the way to choose to change your habits, to go from the delicious, appealing donuts to still delicious, but less appealing fruit. They're less tasty to our taste buds, even though you might have trained yourself to like them. And in the same way, you need to learn to address the cognitive biases that cause us to make bad decisions. So, how can you prepare? We'll finish with this slide and then we'll take some questions before we go to the specifics of preparation. How can you prepare? You need to make long-term changes to your plans and think years, not weeks. So that is the preparation that you need to be making. And we'll talk in the next part after the break about how you specifically prepare. But for now, I'll take some questions to discuss this matter.
First question is not a question, it's a comment. It says, great presentation.
Thank you. I appreciate it.
Okay, we do have one. It says, I'm planning to retire in 6 years. Of course, my investments are impacted. Any advice on how to prepare?
What I would strongly advise you to do is look at the market right now and realize that it's greatly overpriced because the market is not pricing in the pandemic. It's nearly back to pre-pandemic highs. This is ridiculous. We'll have not only a recession, which is pretty much guaranteed, that even from the things that we already did, a lot of people are not realizing that we'll need much more restrictions, that the states that are opening up are already seeing an uptick of cases. Most of the states that are opening up are seeing an uptick of cases. Before the cases overwhelm their hospitals, they will have to have restrictions. Otherwise, there'll be 5 to 10% of the people who get COVID-19 will be dying. And that's not going to be politically acceptable, regardless of what you think about it morally. I think it's morally unacceptable, but that's a different matter. So you'll have a lot of problems going into the future. The stock market has not priced this in. It's like the Goldman Sachs making bad predictions. The stock market is right now not making good predictions. So I can tell you that what I have done with my investments is I've moved them into safer stocks, ones that are going to be aligned with with people spending much more time at home than many anticipate because of the waves of restrictions and loosenings. And so there are a number of stocks that you can figure it out. And like things ranging from Amazon to Microsoft because of Microsoft Teams, Slack, and so on. That's one sort of thing that I'm doing. Another sort of thing that I'm doing is I'm shorting a number of stocks, a number of areas of the market that are specifically going to be highly impacted. So the best short I've found is a short on real estate. Right now, a lot of people are not realizing how badly real estate will be hit because a lot of people won't be going back to the office. There'll be a number of companies have already permanently decided to transition. So nationwide, for example, not even talking about Google and Facebook, which have decided that they're going to do some permanent work from home, but even old companies like Nationwide in Columbus, Ohio, where I'm based, it has decided that it will transition some of its staff permanently to home, and they're closing some of their offices. So commercial real estate will be severely hit, and some of the private real estate, but especially commercial real estate. So there are a number of stocks that short commercial real estate. I think the one I got was SRS. I'm not making stock recommendations, not benefiting from it, just sharing what I did. So that's something that I have done. So that's something for you to think about in terms of your investments and what you want to be doing. So I think that's what you were focusing on in terms of investments. For your career, if you plan to retire in 6 years, you want to be careful and think about to what extent that the industry that you're working in right now, the company that you're working in, how well it's prepared to survive and thrive in the pandemic. So, for example, one of my clients was the COO of a chain of about 24 restaurants in the Midwest. And when the situation hit, I talked with her, and she realized that it's just not going to be a good future for her to stay in that industry. So we worked on transitioning her, and she recently found a job as a regional manager of a chain of large grocery stores, or a large chain of grocery stores. So that's a much better. I mean, she went down from COO to regional manager, but she has a lot of room for growth, And that's a much better, more promising future for the industry. So that's another thing that you want to be thinking about. You can change, of course, you can work in the same job, but in a different industry if the industry that you're currently working in is one that relies on face-to-face contact.
Okay, great. I think we're going to go ahead and wrap that here. There are a couple of more questions, and just letting folks know that we will be exporting and getting those questions out to Gleb via email post. But also, a lot of comments came through saying that your presentation is very sobering for them, that they're sharing this information. Some people said that they're going to share this information with their kids as well. You know, folks planning for the future. So at this time, we're gonna go ahead and take a we're gonna end Q&A for now, and we are gonna transition into a 10-minute break. But prior to the 10-minute break, everybody down the live stream, please stand by because we're gonna be taking attendance in a moment. So at this time, Gleb, if you want to go ahead, and we'll transition away from you and then down to our stream for now.
Hey everyone, welcome back. Well, we had the bad news in the first part. Now let's talk about the good news, how you can solve this problem. Now, this is something that there's going to be a lot of difficulty, of course, in addressing a problem of this magnitude. And this is you, by conveying this information to the leaders of your organization, as well as using it in your own decision making, this will really help you address the next several years, which will be difficult, challenging, hard. It's hard for me to share this, it's hard for you to hear this, but this is the truth. So you need to make fundamental changes to your business model, basic fundamental changes to your business model for the large majority of organizations if you're going to survive and thrive in the situation. You want to focus on a future based on virtual interactions, mainly virtual, some social distancing, but mainly virtual, because you don't want to yo-yo back and forth during the restrictive periods and the open periods. That creates a lot of disruptions, that creates a lot of chaos, that creates a lot of hassle, and that creates a lot of problems for internal auditors who want to have stability, clarity about processes, and of course for organizations which want clarity, stability, processes and systems. So I strongly encourage you to make a commitment and help your leaders make a commitment to virtual teams and virtual offerings. It's incredibly important. This is what I tell all my clients, and this is what I'm really going to recommend strongly to you. And one immediate benefit of this is that you can get a lot of money by ending office space lease. You know, if you break your office space lease, pay the 2-month whatever, that's the usual cost of breaking the office space lease. It's going to save you a lot of money in the long term. You can hold meetings in co-working spaces and so on. This will also help you make that commitment by burning the bridges and help make the commitment to virtual teams and virtual offerings. So that's a recommendation I make. But let's talk about more broadly. That's just one tactic out of strategies. We'll talk about the internal business model and the 6 areas of changes that you have to make to it in order to adapt and plan for the reality of this new abnormal in order to survive and thrive the pandemic. And then the same thing for your external business model. And finally, we'll talk about how to make an effective long-term plan for the future. Not one that's going to be disrupted immediately once you make it because of planning fallacy, but one that will actually survive the situation and help you orient toward whatever future happens to take place. So 6 areas of internal business model change. Internal controls, not surprised by this. Motivation, engagement, effective communication, resolving conflicts, cultivating trust, and accountability. Those are the 6 major areas that you have to address when you're switching from a mainly office-based team to mainly or all virtual-based team, or even hybrid model, which again, I strongly encourage you to go all virtual, but even in a hybrid model, all of this applies. Internal controls. Obviously, you have to ensure financial security. When you are working in a home space, virtual team, there will be different systems and different processes that you have to establish in order to ensure financial security. Lots of businesses are still functioning with their BCPs, their business continuity plans, and those usually don't account for financial security. Maybe they account for a short-term break in financial security. Mostly they don't, because just a week-long break, maybe 2-week-long break for business continuity. But this is going to be years, not weeks. So think years, not weeks. How do you ensure effective financial security for the long term in this situation of virtual teams? Then another important area especially for those internal auditors who work on the IT side of things, but even those who don't and just have input on this area, you want to address cybersecurity vulnerabilities. Lots of people are working from home and are going to continue working from home. And the FBI has already noted that there's a big uptick in hacking, data breaches of companies. And it's easy to see why. When people work at home, they have computers that are much less hardened than those that they have in the office. They also are not used to following the cybersecurity protocols that are necessary to address cybersecurity at home versus the office. So they need to be given training, and your policies, cybersecurity policies, need to be adapted for the home environment, and you need to provide funding for people to buy hardened computers, hardened software, hardened hardware. So that's another one. Then you want to think about your general compliance practices. Every organization has its specific compliance practices. Can't go into all the details, of course. But what you want to think about is, how do you adapt your compliance practices to the virtual environment? And then remember, you need to add an additional layer of compliance practices with the CDC guidelines, because there will still be some in-person interaction if you're having meetings. Some companies insist on a hybrid model instead of going full virtual. So you want to develop clear compliance with CDC guidelines. And finally, this is really important, and the leaders for whom your trusted advisors will especially appreciate this. You want to create new internal measurements, revise them. Right now, I'm sure you have measurements for effectiveness and efficiency. And those are two separate areas. Effectiveness, how impactful you are, and efficiency, how many resources or how little resources you spend doing it. You need to revise those measurements to be adapted to the virtual environment. They're not going to be the same measurements that you use in an in-office environment. So that's internal controls. Motivation, engagement, second area. Now, there's been already a lot of research showing that employees, even before the pandemic, were not very motivated, not very engaged. Only 34%, so a third, of all employees were engaged and motivated according to Gallup surveys before the pandemic. And engaged and motivated means that they are creative, they are committed to the company, they take time, they are ready to stay after work, they're ready to sacrifice for the company. Most people, over 50%, are not. They're just punching the clock, doing the minimum they need to do to get by and perform the work to not get fired. And they leave at the first available opportunity. And about 15% or so are actively hostile, bad-mouthing the company and trying to find a new position. So that's just the breakdown before the pandemic. Now, of course, after the pandemic, what you had was a couple of weeks, several weeks, when people are really rallying around the flag, rallying around the company, are motivated and engaged. That will fade. Just because people working from home, one of the fundamental aspects of who we are, going back to the evolutionary psychology, we're very tribal beings. So if we're not surrounded by people who are working on a task, it's hard for many of us to be motivated, especially people who are extroverted. It's easier for people who are introverted. Many internal auditors are, but many of the employees, especially sales personnel, marketing personnel, tend to be very extroverted. So this is going to be very hard for them to be motivated when they're working from home. And so they need to be especially engaged. This is a difficult area, and this is something you need to think about, especially since a lot of people are dealing with trouble due to COVID-19. I mean, their kids are home from school, preventing them from working effectively. They're dealing with teenagers who are back from universities and dealing with that. And this is not easy. You need to provide support and guidance to the employees in your companies and help your leaders do so. Help them realize that this is an area they need to address effectively. So, next one, effective communication. Now, communication is already difficult when you're communicating in office environments, face-to-face. It becomes especially difficult if people are used to face-to-face communication and they have to make a sudden switch to virtual communication. Most virtual communication is text. So whether you're using Slack, whether you're using Asana, Trello, Microsoft Teams, other software, other collaboration software, it's overwhelmingly text. And when you're using text, you lose the vast majority of non-verbal communication. I mean, you can use emojis, right? But that's not going to help you too much. You lose tone, you lose body language, you lose the ability to see when somebody is looking anxious, when somebody is looking concerned. You're not sure, you can't tell that by their face. And you also can't tell by the tone. When I say, I think Michael should take this project, or I say, I think Michael should take this project, those two sentences mean very different things. But if I write them down, they mean the same thing. So there's many more misunderstandings that happen in virtual communication, and it's essential. This is professional development. It's essential to train employees in this area, how to communicate effectively in virtual teams. Next, resolving conflicts. Related to, but not the same at all as effective communication, because conflicts can come from poor communication, or they can come from other areas, inherent internal challenges. When you're face-to-face, it's really much easier to address conflicts. You can see when somebody is looking anxious, worried, concerned. You can see that, you can address it, you can have face-to-face conversations. That's much more effective than virtual conversations. In a virtual team, it's much harder to even notice problems because you're not seeing somebody's body language and somebody's tone of voice, hesitant tone of voice. So you're not seeing that. And that makes it much easier for problems to arise and makes it much harder to resolve problems. So it's very important to offer training in this area in order to address the kind of problems that arise from virtual communication and resolve the kind of conflicts that arise in virtual communication. That's another area. Cultivating trust. Now, many people don't think about this. This is not something that people intuitively think about, oh, virtual teams, well, you need to cultivate trust. This is a big area. No, they don't think about this, but this is incredibly important. Cultivating trust is something that gets really lost in the conversation. Because in office settings, it's natural to cultivate trust, to build human relationships. So when you meet somebody, you talk to them about what happened with your kids, or what's going on with your local sports ball team, or something that crazy local politicians are doing about something else. You talk about stuff that's important to you and that's important to them, or just casual chit chat. You build those relationships, you build those bonds, and those bonds create trust and they create effective teamwork. And it's not intuitive, it's not natural to realize this because it happens just intuitively. It happens without us trying to do it. But in virtual settings, this doesn't happen intuitively. This doesn't happen without us trying to do it. So what you need to do, this is not training. So I talked about a couple of things that are a matter of training. This is not a matter of training. This is a matter of policy. You need to create virtual venues for doing this. So for example, already before the pandemic, I worked with a number of clients who are transitioning to all virtual teams, from office environments, hybrid teams, all virtual teams. So what we did was we created a number of venues depending on the company. So there was, for example, this one company that decided to use Trello as its main collaborative feature, as its main collaborative tool. And what it had was, for various teams, teams were anywhere from 3 to 10 people with a supervisor, team lead, whatever, and then a number of team members. So there was separate Trello boards, venues for collaboration. And there was a Trello card where everyone, once they got to work at the start of their workday, they had to share. This isn't obligatory, it's a matter of policy. It's essentially punching the clock, checking into work. They had to share how they're feeling, how they're doing, what's been happening with them in their personal life, something they want to share, something interesting, an interesting fact about them that most other team members don't know about, and finally, what they're planning to work on, their major project for the day. And then they have to respond to at least 3 other team members. So if it's a team of 3, two other team members if it's a team of 3. So this is something that creates immediate bonds. It creates immediate human contact. Every morning, you see who's been on Trello on the card, who's commented, what they shared, what's going on with them, their mood, everything that is relevant and important that they want to share. And that creates a sense of human connection and bonding, and even more so when you respond to them. When somebody says, oh, my kid got sick with such and such, and you say something like, oh yeah, that happened to me too, here's what I did. And that creates that immediate human bonding, that connection, or somebody says something like, oh, I'm planting, radishes, and they're like, oh, I hate radishes, why do you plant that? All of these sorts of conversations, it gets kind of fun. But anyway, they create that human sense of belonging, that bonding, that trust. So that's the kind of thing that you want to be thinking about creating, and it's not intuitive at all. So that's one thing, that's the obligatory one. Now, you also want to create a space for people to autonomously engage, autonomously share. So there was another venue on that separate Trello card, where people can just share about anything they feel like from their personal life, non-work stuff throughout the day, whether their opinion, an interesting article they read, or a meme they saw, or something that, some recipe that they really enjoyed doing, and they can have conversations with other people throughout the day. That provides a lot of spontaneity and provides people with a chance to share and connect with each other in a spontaneous way. So that's kind of a good way of thinking about it, having an obligatory specific policies thing, institution, venue, where people are obliged to share in the morning about their personal life and maybe what they're working on at work, and engage with others, respond to some others who did that. So it's an obligatory thing. And having a spontaneous venue for people to engage with each other in some fun, engaging way about whatever they want. That's kind of a minimal approach to cultivating trust in the office. And believe me, when you help your leaders understand that it's important and it's doable, they'll be very grateful. Finally, accountability. This is really important. And again, something that it's not part of a BCP. It's not part of that business continuity plan, because business continuity is only for a week or two. But for the long term, you need to provide and create accountability in the non-office environment and virtual teams. In office environments, it's easy to naturally create accountability. When you, as a supervisor, you can just walk around the office, see who's doing what, see who seems disengaged, concerned, anxious, frustrated, and chat with them. Tap them on the shoulder, say, hey, what's up? What's going on? How's your day going? Something like that. Check in with them, engage with them, connect with them, collaborate with them. That's the chain of command accountability. Now, it's also something that your peers can do. So your peer can pop into the office and say, hey, Bob, you can pop into somebody's office and say, hey, Bob, where's that report that we talked about you sending me yesterday? And then Bob was like, I'll get right to it. You'll have it by 3 p.m. today. So that it's much harder to ignore someone when they're standing right there in the doorway of your cubicle, rather than sending an email, because that's kind of a little bit escalating and making sure that you hold the person accountable. It's much easier to ignore an email or a Microsoft Teams or a Slack message or a Trello comment or an Asana comment than somebody standing there in the doorway, right? So this is something that you need to address. You need to create new structures to enable accountability, both up the chain of command and peer-to-peer accountability. So what I mentioned, the companies that I worked with transitioning, one of them, what they did was they had a report that somebody files every Friday to the supervisor in a public way, in a public fashion. So there's a Trello card for reporting, and each individual has their own Trello card for their weekly report. They file a report on the kind of things they did, the measurements including specific measurements, if they made number of sales calls, whatever is relevant in your area, to whatever extent that could be measured, and then how they accomplished their goals for the week, the top 3 priorities for the week, what they did, what they feel were their challenges, what are opportunities for improvement, what they plan to do differently next week, what they plan to focus on next week. So it's kind of up the chain of accountability. And then they also tagged several of their peers with whom they collaborated in projects, and commented about how well their peers were doing in their project collaboration, how they would rate their peers, and something that their peers are doing well and what their peers could be doing differently, can improve. So that creates that peer-to-peer accountability, because the supervisor is a supervisor of the peer as well, so they're reading the report. So that's one way of creating accountability, both the chain of command and peer-to-peer in a virtual team. Next, external business model. So you want to think about shifting your external business model as much as you're thinking about shifting your internal business model. Service delivery, 6 areas again. Service delivery, relationships, managing disruptions, shifting norms, unknown unknowns, and finally, outcompeting your competition. First, service delivery. Of course, this is what you're doing. This is your offering. So what your company is offering, whatever you're providing for people, you want to transition your offerings to virtual as much as possible or socially distanced if it's not possible, but there's many more possibilities for virtual service delivery, goods delivery, products, whatever your services, whatever you're doing, than you might think. And some will find it easier than others. Of course, some might already just need to shift their if they're selling products, they might need to shift them from retail to direct to consumer or to online retail. And some may need to be more creative. So, for example, a lot of my activities are consulting, coaching, training, speaking in person. So I'm transitioning all of them virtually. And there's so many people who are trying to hold conferences in, end of 2020, end of this year. And they're inviting me and I'm like, are you sure you'll have a conference? How about if we sign a contract that if you don't have a conference in person, we'll have a virtual speech. So, because just being realistic, a lot of conferences, they will not happen. There's just not, it's very, very unlikely that conferences will happen. Large conferences over 100 people or mid-sized conferences over 100 people will happen by the end of 2020, and I think they probably will not happen in 2021 either. We'll need to wait for a vaccine until a large conference, and that will, after vaccine is confirmed, then conference can be planned, scheduled, and of course, after it takes a long time to plan, organize, schedule conference. So even in the most optimistic scenario, by early 2022, you probably won't be having conferences effectively until late 2022, and that's very optimistic. So that's more than 2 years, and I think a lot of people are being way too optimistic about conferences. Anyway, I'm transitioning to virtual coaching, virtual consulting as well. So those are examples of how I'm transitioning, and you want to be thinking about how your company can do the same thing and how you can support your leaders in doing that transitioning. I mean, I'll be honest, some businesses are not going to make it. There's a reason I helped my client, the COO of the chain of Midwestern restaurants, transition from her role as the COO to her new position as the regional manager of regional district manager for a number of grocery stores, because I don't think restaurants will really make it very well at all. This is going to be very tough, very rough. Restaurants are not something that will survive this situation well. They already have pretty low profit margins, and I think that they just will not make it, and this is not a good bet, not a good industry to be in. A lot of other live face-to-face venues, not good industries to be in. Bars, nightclubs, not a good industry to be in. Cruise ships, obviously. Airlines, no. Various travel transportation, no. These are not good industries. So just being honest. All right, relationships. You're probably used to cultivating relationships face-to-face, like I am. Meet with each other, have shake hands, whatnot. That is the kind of networking face-to-face. That's the kind of thing that you're probably used to doing. But you need to learn and need to help the people in your company, especially sales personnel who are so face-to-face oriented, learn how to establish new relationships virtually and how to cultivate existing relationships virtually with external stakeholders. Of course, we talked about the internal ones, virtual teams earlier. This is external stakeholders. That includes stakeholders like clients, service providers, political leaders, especially important with the stimulus and various other dynamics going on, prospects, investors, suppliers, everything like that. And especially with political leaders, as a number of, I'm sure as internal audit professionals, right now there's a big serious conversation happening about liability issues, insurance liability, whether there's certain political leaders who want complete protection for businesses from liability for COVID-19 issues, others who don't want that. I have no idea how that will shake out. I have no predictions on this. I'm not an expert in the political games of the situation. But there's certainly a possibility that that liability will not be offered for COVID-19 related issues. So that's going to be especially important for thinking about political leaders and many other things, of course, money, stimulus, and so on. So this is a matter of professional development. I talked about some areas that are venues, institutions, some are organizational decisions like service delivery virtually, and some are professional development. This is purely a professional development area. You can train in how to cultivate relationships, existing ones and establishing new ones in virtual settings. And this is something that you definitely should be doing because it's going to be crucially fundamental for your success and for your company's success going forward. Next, managing disruptions. So external stakeholders are going to be really disrupted. I mean, obviously there's major disruption going on for everyone. Talked about myself. Of course, you're suffering from disruption right now, your companies, you as individuals, your careers. But the good news is that you're listening to this webinar and seeing this webinar, and you're learning about the actual pretty traumatic situation that's going on. It's pretty harsh. It will be long-term, it will be very painful, it will be very impactful. You're learning about this, and then you can take steps to address it. A lot of external stakeholders with whom you're dealing with, I talked about those people with whom you have relationship with, external stakeholders with whom your company has relationships with, they don't have that. They don't have that long-term plan. They don't orient toward the disruptions coming from the pandemic. So you need to realize you need to protect yourself, your company, from their failures. This is just the reality of the situation. A number of them will not do the things that are needed. A number of them will try to open too early and screw up anyway. There will be a lot of problems. You can try to convince them that, hey, this is going to be a major issue. I mean, as an auditor, you have less power, less external stakeholder engagement, but you can try to get your companies to help people who do more external stakeholder engagement. You can try to get them to convince your company's external stakeholders to be more engaged with long-term planning, but many won't. And you need to protect your company, your organization, and your career from their failures. Shifting norms. This is something that you want to be thinking about, relevant to your business, your industry, your career, whatever is going on for you. Think about that context. Think about the longer, broad context. We talked about how after several years, realistically speaking, it probably won't be two, probably will be 3 or 4 or something like that. After several years of restrictions and loosenings, people's habits, norms, values will be changed, their desires, their expectations, and you want to think about that. How in the business relevant to you, and of course, this is all stuff that you're going to be talking with your leaders about this. How in your industry, whatever you're doing, what kind of habits, norms, expectations, values will be changed? What will be developed? What will be going on? This is something that you want to be thinking about because your company can be in a position to get ahead of these shifts. If you can anticipate them effectively and get ahead of them, you can produce the products that are necessary for the market that will satisfy people's needs, wants, desires, habits, expectations, and so on before they even know they have them. And that's the wonderful position to be in. That's the best position to be in because then you can make the most money, your company can make the most money, and it can survive and thrive in this situation. Unknown unknowns. This is something you have to guard against. Now, the pandemic, I'll be realistic, it was a predictable disaster. There are a number of people like Bill Gates, very prominent from both philanthropic. He obviously comes from a business background, and right now he's very involved in philanthropy. And he was predicting that we will have a pandemic and we're not nearly prepared for it. He had a TED talk on this, I think in 2017, talking about this and how we're not prepared, how this is something we really need to prepare for. And a number of other people were talking about this and warning, hey, we're not prepared for a pandemic. And a number of people were saying already in January 2020 that this will be, January, February 2020, I was talking about this, how this will be much worse than we think it will be, and that people are really not nearly as prepared as they should be. That's why my publisher approached me to very quickly write a book about this. I mentioned the book, and you can get some resources from that book. But anyway, so this was a predictable disaster. This is something that we could have predicted. The vast majority of people, of course, did not. So what you can do for your company as auditors is thinking about this, creating systems and processes to scan the environment for potential major disasters and help your company protect itself against these disasters. So think about this. This is an important institution. This is an important process. This is something that you can help your company develop, how you effectively scan for these disasters. And that's how you make an unknown unknown into a known unknown. So it's hard to pronounce. So you have an unknown unknown, something that you don't know that you don't know. And you can have a known unknown, something that you know that you don't know. Here, in the case of the pandemic, you can make it unknown, a known unknown, meaning that you know that a pandemic might be pretty bad and it might happen. You don't know when. So you don't know certain aspects of it. You don't know how bad it will be. But you can know that, hey, this is a situation, this is a pandemic, and this is how we'll address it and prepare for it. And by having a plan, not simply a business continuity plan, but having a plan for major disruptors like a pandemic and other major disruptors will be very helpful for your business. So that's something that you want to be thinking about. And that's how you protect against them. But of course, not everything can be predicted. You have to be realistic. You can't predict everything. This is why cash cushion is very helpful. This is a really beneficial thing to have. And a number of companies that are smart, wise, they have a cash cushion against serious problems. By contrast, take the airlines. None of them had a serious cash cushion. They were buying back their shares, even though they had very profitable, more than decades since the fiscal crisis. They didn't build up a fiscal cushion. They were buying back their shares, so they were caught short. They had very little cash in hand compared to the need, of course. I mean, not little, but compared to the reality of the need, the disruption in the airline industry, they had very little cash in hand. And what could have happened if one of the airline companies had sufficient cash in hand, this would be a good time for them to think about acquiring another one that didn't. And the government might have gone that route if some of them had sufficient cash in hand, but they didn't. So they all had to be bailed out by the government. Not great. Next, outcompeting your competition. This will be something that your leaders love. I can guarantee this to you. This is something that my clients in the top positions get really excited about. The steps I shared, so the 6 areas for internal and the 6 areas for external, if you actually go ahead and implement them and help your leaders as a trusted advisor implement them, they'll help you, your company, gain a major competitive advantage. Major competitive advantage because you'll be oriented toward the long term. You'll sacrifice some short-term goals, some short-term interests, like opening up early and getting some cash in hand and having some of the lots of troubles and hassles, of course, that are involved with a virtual switch, permanent virtual switch. But you make that, you protect yourself from those repeating waves, you'll be so much better off than your competition. A number of your competition, members of your competition, whoever they happen to be, will fail to adapt to the pandemic. They'll be like Tesla, running to open up things whenever they can, going against federal regulations. And this, I can pretty much guarantee to you, will really hurt Tesla, its reputation, its credibility, and the company itself as a whole going forward. A number of companies will also be hurt by their practices in this. I mean, Hobby Lobby, for example, was trying to, I don't know if you heard about this, but Hobby Lobby, which is a major arts and crafts store, was trying to get itself labeled as an essential business because they produce clothing that people can use to make masks. I mean, this is so ridiculous. Of course, people can buy the things that can be used to make masks elsewhere. They don't need the cloth from Hobby Lobby. So Hobby Lobby is not an essential business, and they got a quite big hit to their reputation for trying to be labeled as an essential business. This is an opportunity for your company, if you take the steps that I shared, to get ahead of stumbling competitors. This is a great opportunity. There are many ways, there are many things you can do right now. You can have your company help your clients do right now, help the company do right now to get ahead of the competition already. So for example, what a number of my clients are doing is that they're contacting major targets who are currently not working with them. They're contacting major prospect targets and saying, hey, we took these steps, A, B, C, D, and E to be pandemic proof. So we're taking these steps. We're going to be ready to survive and thrive in this pandemic. If there will be restrictions, if the vaccine won't be created by the end of the year, as it's pretty unrealistic, as some people are hoping, some people are saying, if we don't have a vaccine fully approved by the end of the year, if there will be more waves of restrictions and loosenings, and if our competitor is not doing a sufficiently good job, if they're not pandemic proof, maybe consider us as, as an option B, plan B, for a pandemic proof provider of services. So there's a physical company, for example, which I'm working, that's offering to provide services. And you know what? Those prospects will remember them when the time comes, when the restrictions will come, when the vaccine is not created and approved by the end of this year. They will remember them. And this is something that you can help your leaders be in a position to be very good at. So that will help them, of course, seize market share. That's seizing prospects, clients, something they can do right now. And they can reserve resources in advance to hire away good employees from stumbling competitors. This is, talent will always be needed. And this is something you want to have a cash cushion for, partially for this reason. We'll talk more about that. Those are the 6 areas of the external business model. Let's talk about the last big topic, how you can plan effectively for the long-term impact of the pandemic. I talked about the phrase that failing to plan is planning to fail is a bad phrase, very problematic phrase. What you need to, instead of making a perfect plan, thinking that it will go well, you need to make an adaptive plan, one that considers a number of potential scenarios, possible futures, thinks about what will happen 5 years out in a number of those futures, addresses problems that might come up in any of those futures. So you're thinking about problems in advance, and opportunities. What kind of opportunities might happen? How can you bring them about and seize them? Then think about the resources that you need for all of these scenarios. And then think about the information that would indicate to you which of these scenarios is actually happening. So which of these futures you're going toward. So possible futures. You want to plan for a variety of futures. So for example, with the pandemic, you can plan for the optimistic one, vaccine available by 2022. So that's the optimistic one, pretty low likelihood that vaccine will be available by the start of 2022. The moderate one, that vaccine will be widely available by 2024, with that period anywhere from late 2022, that vaccine will be widely available, people will be widely vaccinated, to late 2026. Or the pessimistic one, that it will be available by people widely vaccinated by 2027. So that's the pessimistic one. And you want to invest your resources in accordance with each scenario. So you want to husband your resources, reserve them, and invest them in accordance with each scenario. I'll talk about what that means. But now, think about those possible futures. Think about 5 years out. Each of those futures, imagine what would your business look like and what would your career look like. So for the person who said that they're going to retire in 6 years, what would your career look like in each of these futures in the 5 years from now or 6 years from now? In each of these scenarios, the optimistic one, think about that. The moderate one, think about that. And finally, the pessimistic one, think about that. What would your business and your career look like in each of those scenarios? Next, think about problems. Problems in each of these scenarios. So in each scenario, the optimistic one, the moderate one, the pessimistic one, what might the problems be? And then think about ways of addressing them in advance. So there are a number of ways that you can address these problems in advance. So if you're, let's say, one of the problems might be liability from failing to follow CDC guidelines. And that's pretty easy. CDC guidelines are pretty strict. And if indeed there will not be passage in the federal level of liability, a number of states are passing laws, a number of states are not, protecting companies from liability. And if there is no federal level, well, you want to be thinking about, this is a problem that might come up, might be sued for an employee getting sick and dying from COVID-19 that they contracted at our place of business. One way of addressing that, of course, is going all virtual. And that's kind of one way of addressing this liability, only having meetings in co-working spaces where the liability would be on the co-working space that didn't sufficiently clean itself if something happened, people who aren't following guidelines. So that is something that you can you can put your liability on someone else. That is something I strongly recommend that you do. Think about that. Many other areas like this. Think about, let's say, I talked about the internal businesses, the internal business model, the internal controls. Think about the internal controls for financial security. What kind of problems might come up in terms of financial security of people being at home, and how can you address these problems in advance? So some of these things you can head off at the pass by being wise, thinking about problems and addressing them in advance. And some of these you can make a plan to address them if they do occur. So depending on the kind of problem in your industry that might happen, I don't know what might happen, but for example, let's say for a number of my manufacturing clients have experienced supply chain disruptions due to China having COVID-19 and then having a lot of interruptions of supplies. So that, and China, other countries having close downs, shutdowns, and so on. So you can think about that. And then what we're working on right now is addressing that, having a plan for future interruptions of supply chains, including having backup regionalized supply chains that are going to be more local, and having various backup deals with contractors, with places that can provide various supplies that my manufacturing clients need on short notice, kind of reserving those. So that's another thing that you can be thinking about, making a plan, taking steps. Next, opportunities. So we talked about problems. Now, let's think about opportunities. Opportunities are also great. List possible opportunities in each of these scenarios: optimistic, moderate, pessimistic, and think of ways of bringing them about. I already talked about ways of bringing about opportunities for seizing market share, where you can right now contact a number of potential clients, have the salespeople in your company, contact them, describe how you're going to be pandemic proof and how they can rely on you as a choice B. So that can be one thing. There's many other things that you can do right now to bring about opportunities for yourself. Then think about seizing opportunities if they occur. So let's say one of your competitors goes bankrupt because they're not sufficiently pandemic proof. Depending on your industry, there can be a number of benefits to you from, of course, the obvious one is hiring away their employees who right now don't have a job and are more willing to take a job at perhaps less cost than it would have been otherwise, but also buying up their material supplies and many other things that can happen, getting their service providers, getting their suppliers for much lower prices than would be the case, because those suppliers don't have someone to produce goods for, so raw materials for. So those are things that you can be thinking about right now and make a plan to seize them as they occur. Next, resources. Think about the resources for each of these scenarios to address the problems and seize the opportunities for each of them. Money, time, information, social capital, strategic planning time, whatever is necessary. Make a plan to reserve sufficient resources for the pessimistic scenario. To address the problems and seize the opportunities for the pessimistic scenario, I strongly encourage you to do this. I strongly encourage my clients to do this. Some of them find it very hard in terms of resources. Some of them are middle market companies or startups, innovative startups. Some of those have a lot of difficulty with reserving resources for the pessimistic scenario. Those I strongly encourage. Those we reserve resources for the moderate scenario, but with knowing that it might turn out to be more pessimistic and they need to make deeper cuts, deeper changes to prepare for the pessimistic scenario. Don't plan for the optimistic scenario. Seriously, a lot of people just are very some people think we'll have a vaccine by the end of the year. No, a lot of people are way too optimistic, and so you don't want to plan for early 2022. That's not going to be. It can happen, but it's very unrealistic, and you want to hope for the best, but prepare for the worst. Plan for the worst. I strongly encourage you to plan for the worst. Plan for the pessimistic scenario, at least the moderate one, and reserve resources for that. Finally, information. This is the sixth area of your plan. You want to think about what kind of evidence would you use to see which future you're heading toward. Are you actually going toward the optimistic one, or the moderate one, or the pessimistic one? Those are the futures that you can head toward. And if you see that, hey, the Moderna vaccine is not doing as hotly as people hoped it is, that it's not creating the kind of antibodies in patients that are really necessary for it to be effective, widely used, that can indicate to you that we're most likely not in the optimistic scenario. And by contrast, if it's doing great and wonderfully, and you see that they're about to get approval and produce lots of this vaccine, then we are more likely in the optimistic scenario. So that's kind of things you want to be thinking about. A good source to follow on this, I'll just is Bill Gates. I mentioned his name before. He doesn't have a stake in getting any financial benefits from COVID-19 spreading, and having any vaccines. He's really concerned with saving the world, essentially. That's what he's donating. He donated his money, a lot of his money, to this cause. And he's just very concerned with COVID-19. That's what he's focused on. So he has great source of information on the inside of each of the vaccination tracks, and he's funding a lot of them. So he's funding them not in a way that will get him profit, but funding just the research on it in grants, not buying stakes in the vaccine, not buying stakes in the companies. So Bill Gates is a good person to look at and see what he's saying about the race for the vaccine, what will happen. He does tend to be optimistic, but he overall communicates information with kind of like, how's this sense? He says, I really hope this will be the case, but this should indicate to you it's pretty unlikely that that's the case. So a little bit of reading between the lines helps. But he is overall a good source on what is a realistic situation with the vaccines, what's going on, when we can expect things. You want to monitor this information closely. And of course, Bill Gates is just one source of information. You want to look at epidemiologists, people who are trained to make the right judgments and rewarded for making the right judgments. The consensus of an epidemiologist. Don't choose your favorite one who says we'll have a vaccine by the end of the year because they're hired by the Moderna to hype up their stock prices, which happens. Don't want to do that. You want to look at the consensus of epidemiologists. There are a number of articles on this topic that represent scientific consensus. So that's what you want to be looking at. If you're looking at vaccine, other source of information. If you're looking, let's say, at whether there will be indeed liability for COVID-19, there are a number of legal sources that are estimating this. Of course, they're lobbying for there to be most of them are lobbying for there to be no liability for there to actually be liability for COVID-19, because it's one of the ways that lawyers will make money. And not saying it's bad or good, it's just the reality of the situation. So you want to see what kind of incentives people have in sharing their information. Epidemiologists, and generally speaking, don't have an incentive for sharing information that is not accurate. They get rewarded for sharing accurate information unless they're on the payroll of a specific company. And you want to adjust your plans accordingly based on the information that you're getting. So if you're getting information that the race for the vaccine is not going as quickly as you can be more confident that we're in the moderate or pessimistic scenario. That's an example of how you would be evaluating the information and seeing which of these futures we're heading toward. And then execute, help your leaders execute on that future. This is going to be a difficult thing for you to focus on. This is going to be a difficult thing for you to convey. But the sooner you convey this information, the sooner you accept it, the sooner you help your leaders accept it, and the sooner you execute, the further ahead you'll be of your competitors, and the more protected you'll be, the more you can guarantee the safety and security of your company, of your internal processes. And as auditors, of course, that's your responsibility. And the safer the company can be in outcompeting its competitors, which is what your leaders want to accomplish. So that's what I wanted to share. Now, if you want to get additional resources on this, they're going to be at tinyurl.com/DE-event. So again, tinyurl.com/DE-event. There's a free coaching session with me. Happy to help you individually integrate this information into applying it for your company and or for your career. And then 2 chapters from my forthcoming book, Adapt and Plan for the New Abnormal of the COVID-19 Coronavirus Pandemic. The ebook version has already been published, and the paperback version will be available on May 15th, so in 2 days. So that's what I wanted to share, and I will be happy to take questions right now.
Okay, thank you, Gleb. Folks down the stream, you can see that we have opened up the Q&A field for you to be able to go ahead and ask another question or two in the time that we have here. So go ahead and, wow, they're coming through already. First question, Gleb, is what do you think the future of the gaming industry is?
I think in the short-term future, it's going to be pretty bad. Right now, a lot of people are rushing back to casinos and other places like this, but this will not last. Casinos, there will be a lot of negative press as there will be some super spreader events for casinos. People will be scared. They will not go. They will reduce their going to casinos after this initial rush, and the restrictions will be placed in casinos in particular as it becomes obvious that they're a super spreader place. I mean, I know Las Vegas mayor is not keen on restrictions on casinos, but I think this will definitely happen. So this is not a good place to be in. This is not a good industry to be in. If you can possibly get out of this industry, that's something for you to very seriously consider. Of course, if you are in more virtual gaming venues, though, that's going to be fine. So a lot of the gaming excitement will turn to more virtual gaming, virtual gambling. So that's going to be a growing industry.
Sounds good. So we have 3 follow-up questions related to that question, and I'm going to try to combine them, though there are 3. You'll see what I mean, Gleb. What do you think the future is for the banking, the future of universities, and the future of entertainment, i.e. movies, television?
Mm-hmm.
I know there's a lot of different subjects, but maybe you could touch on
Sure.
a couple of those.
Banking will be moderately hit, and here's why. Right now, banks are making seriously good money with the government transition stimulus going through them and being backed by the government. So that's not going to be a problem. The problem with banks is going to be, which a lot of banks are still not thinking about nearly sufficiently, is going to be with how bad the recession is, where there will be many more defaults, many more hits to their profit model. Some of the loans will go bad, many more than they're thinking about right now. And so they'll take a moderate hit in the medium term. And of course, they'll eventually have an upturn. But in the moderate future, so something like maybe a year or year to 3 years, it will be bad. So that's going to be not nearly as bad as the gaming industry, but that's going to be bad. Universities. What will happen with universities is that a number of smaller ones, and especially liberal arts colleges style ones, regional ones, will go out of business. This is just the reality of the situation, because there's going to be much more virtual education. Virtual education will be centered in large universities that can provide much more high quality experiences, in terms of, not saying that professors at small universities are low quality, but they can't compete with the kind of name recognition of places like Harvard or Ohio State, where I taught for 7 years. Those have much more name recognitions. Students will be going there, and those universities will be offering online credits, various certifications for much less, in order to compete and get these students in. So a lot of smaller universities will close, partially because they're just not going to be providing that face-to-face education, which a lot of students value, but that's not going to be something that's very effective in the future. These face-to-face venues with more restrictions going on, openings, loosenings, restrictions. So you'll have a lot of failures in smaller liberal arts colleges and smaller institutions, and more concentration of students who still need that degree for the job at larger universities, state universities like Ohio State, which will be teaching large, MMO, the mass online classes. Those will be the future of higher education, and those will be the institutions that provide that future in the most flexible way, will be ones that survive and thrive. So that's going to be universities. And what was that last one? The entertainment.
The last one was related to entertainment, i.e.
Right.
movies and things like that.
What I think will happen is that a lot of entertainment that relies on face-to-face movie theaters, stuff like that, theater, dance, those will not do well at all. You have a streaming experience for dance is not nearly as good as coming on. I say this as someone who loves watching dance. It's not nearly as good as, and I've tried it, as actually watching people in front of you. There will be many less opportunities for that, realistically speaking, because there will be so many more restrictions, so many challenges. So face-to-face entertainment venues will not survive well. Sports will be somewhere in the middle. I mean, of course, they have the ability to have sports on television, but they'll take a serious profit hit by not having fans in the stadium, and that will be a big problem for them. Hollywood and so on, of course, they're going to suffer from movies not being shown in theaters. They will focus more on streaming services, but their profit model, their business model will be seriously hit. And a number of them will not adapt in a timely manner because they're underestimating the extent of the damage from the pandemic. So that's kind of the Hollywood and so on. The streaming services, the ones that are made for virtual, those will be the ones that do best because that's what people are consuming, and their business model already aligns with this area pretty well. So those are the ones that are going to be doing best in the medium to long-term future.
Okay, I think that we're going to have to wrap at that. There are a few more questions, and a couple of more were more and more about specific industries, travel industry, and things like that.
Sorry about
Maybe
travel.
the link that you provided, the tiny URL link that you provided, if you're able to, it's hard for you to kind of go up and just every single industry and give your outlook on that. But maybe if there's additional resources at your link.
Yes, so if you go to that, I will follow up with you, and then you can ask me any questions, any of the questions that you didn't have a chance to ask me. I'll be happy to answer those questions. So
and
please
once
do
again, folks, if you didn't get your question answered, we will be sending these questions out post-event for them to be answered as well. Once again, thank you, folks. Thank you, Gleb, for your awesome presentation. At this time, folks, down on the stream, we are going to go ahead and transition to our next presenter. So please stand by, enjoy the music, and we will be back momentarily.